I have one more question for you about kind of your spiritual, how your spiritual practice and your professional work. Is there a connection?
Well, I'm glad to talk about it. I incidentally am a life member of the Rosicrucian Order, and their teachings have been very helpful to me since 1940. And I had good teaching from the Protestant Episcopal Church of America from the time I was 3 till I was 23. But I haven't been going to church since I started in practice. So I have to say that on the personal level, I have had my difficulties with finding myself to be a public servant. I don't always feel like serving some people, but every professional has their code to live by. So you contain yourself and do what you should. But you may be in a stew inside. And it's in that connection that I have benefited from the monologues, the teaching of the order that comes by mail. And I have some literature around here. They have 1 degree. It's a fraternal order, but it's really related to the teachings of the mystery schools and mysticism. And 1 degree is all about comparative religions in human society. I enjoyed that very much. So I have quite a few paperbacks in the other room about the other religious organizations in human society. I have Tibetan Book of the Dead, and I think I have a copy of the Egyptian Book of the Dead, but I'm sort of drifting in my old age. So what would you like to talk about?
Well, it just seems like so many of the osteopaths, especially the cranial osteopaths, have a sense that the healing that they do is a gift to them, that they're kind of the...
I met up with the teachings of the Rosicrucian Order. I thought, well, the truth of the matter was that when I was starting out in practice, I met up with people who were members of the Order of the Christian Mystics and an astrologer, and all of this was new to me, so I had to investigate it. And there was an occult bookstore in Providence that loaned books, and I think I borrowed everything they had in there. And I was getting what seemed to me to be mental indigestion. So I decided I'd better cool it off a little. But it was while I was in that receptivity that I got the thought that while I was treating, I was an agent, a transmitter is a good word, of healing powers. And what you're aware of when you establish a state of balance is an invitation to that thought. Dr. Sutherland used a phrase later, bringing everything to the still point. And the still point got interpreted as he did not mean it. He was speaking of the simple mechanical truth that if my hand is going to the left, it isn't going to the right. It can't go to the right until it stops going to the left, can it? So there's the still point. And therefore, when I go this way, I come to another still point. The still point is when you bring your automobile to a stop at a red light. And when you stop the mechanism from doing this, it has to be still until it can start doing something else. Even the tide in the ocean. I grew up by Narragansett Bay, and I don't know how many billion gallons of ocean come into that bay twice a day. But they stop coming in at a point before the water starts going out. And it goes out at low tide and stops before it starts coming in again. And that's what he was talking about. And it was mechanical instruction in manual operations. Now, he also taught how to manage the fluctuation of the cerebrospinal fluid. And I wrote, I gave a lecture on that in 1950, and it got written up in one of the OCA reports. Anyhow, I wrote up what Will taught me about managing the fluctuation of the cerebrospinal fluid. I was also on the publication committee of the Osteopathic Cranial Association. The chairman of that committee was Mary Alice Hoover, who was a DO, but before she became a DO, she'd been in editorial work. So she wrote this committee a lot of helpful things for me. We were not managing the cerebrospinal fluid. We were talking about managing the fluctuation of the fluid. And there's a difference in how you say that. So, the fluctuation of the cerebrospinal fluid is one of the factors which shifts the reciprocal tension membrane in this mechanism. The other is the motility of the neural tube. All cells have contractility, motility, and so the whole neural tube alternately changes its shape, and that's why it needs a container